It feels so awkward to start. Okay. Hi, and welcome to Show and Tell. I'm Tara Kuna, and today I have with me Sarah Ward, a registered acupuncturist. Thank you for joining me today, Sarah.
Thanks for having me, Tara.
So glad that you're back. Today, Sarah and I are going to do one of my cases, and what I have chosen for us to work on is headaches. And this is a little bit more in the kind of severe category of headaches because this is a chronic headache. But I'll go ahead and share the case if you're good with that, Sarah.
Yeah, do it.
Okay. So the client is a female. She's 36 years old. She came in and she had a history of having a mild fender bender, just kind of backing up in her car. And she said it kind of shook up some post-concussion syndromes for her. What came up for her was some visual disturbances when she's on the computer and when she's driving, and then also a headache. It wasn't resolving. I saw her one time, and then she came back about a month or so later. She said in the meantime, she developed a chronic headache that she experiences like a band around her head. So it's like behind her eyes is really quite strong, temples, and then goes all the way to the back of the skull. And she's using medications, and she went to the doctor. It's called like a neurovision clinic. Or what they did offer her is lidocaine injections, which is like a local anesthetic, because she's having a hard time managing the pain, even though she's on stronger and like migraine medication and such. So
Mhm.
she has been doing a lot of other treatments, chiropractic, massage, etc. She's wearing dark glasses all the time. That seems to help her. And so she came in for a treatment just to see if acupuncture could help. Do
Yeah.
you want to go ahead and share the points that you would do if you were treating this person?
So what I'd probably go ahead and do, I mean, without knowing too much more, I'd stick with that concussion protocol, like I in that concussion area. I'd do like a modified Magic 12 concussion. Did she say when she or where the head, like, is there one side that's stronger than the other in the headache, or is
Almost
it just
never.
like it's just constant
It's
bands?
very much focalized in the front. So it's eyes and then
Really in the eyes.
the back.
Okay.
But she does also have it in the temples. It is a band all the way across, but that's where it's the strongest. It's kind of like
Okay.
front back.
Actually, no, you'd probably know. I'd probably start at the leg. I'd start as far away from the head as possible.
Okay.
So I think that I would start with, because this is like the Yang Ming, I'd start with Yang Ming. So it's stomach 45,
Okay.
GB 44, and bladder 67. Um, and then I'd move to the leg, and I would do like spleen. So this is where it gets a little bit tricky because it would be like um, palpation and really kind of where I'm feeling the most sensation. So like spleen 6 area, but like potentially all along the spleen up until spleen 9, just to kind of like see what's happening.
So tender
Um,
points for her. Is that what you're
that
looking
would be
for?
she would be tender, or I would just notice something different
Yeah.
in palpation.
Okay.
Um, kidney 10 ish to kidney 8, again like along that whole yin side, and then liver 8 to liver 4, and then I'd move up to the arm and I would hit like small 5, liver 5, Sanjiao 4, and then on the other hand I would do heart 8, PC 8, and lung 10. Um, Typically, when I have migraine patients, concussion, post concussion, I don't needle anywhere on the head
Okay.
within the first, especially if they have an active migraine or headache. I just kind of like set the needles, check in because we should have had a shift at some point. And if we didn't, maybe I'd go back to certain meridians to kind of see if I could get a little bit more of a shift. Yeah,
Yeah, it's great. Love
that's where I'd start.
Yeah.
Mm-hmm.
So the points that I ended up choosing to see her
Mm-hmm.
for that initial treatment was on the ear, I did sympathetic, Shenmin, and liver point.
Hmm.
Other times I've also done Anmian for her. I didn't do Anmian the first time though. And then on the body, I chose pericardium 9, heart 9, and lung 11.
Hmm.
And on the same side of the body, but on the lower leg, I did gallbladder 41. On the opposite leg, I did liver 3. And then on that same side hand, I did something called Wolverine. So it's basically the points that go across the knuckles. So it'd be like
Hmm.
large intestine 3, and then there'd be a point in the middle, and then there's like 2 points in the middle, and then you would hit Sanjiao 3 and small intestine 3. And I went over that. And then also on her thumb, it's a master tongue point called Ju Yuan, and it's for vision disorders. And it's like on the lateral and medial part of the thumb joint where it bends. You
Hmm.
put a point
Hmm.
on either side. And so she wasn't a fan of those.
Even the Jingwells make me shiver a little.
Oh, yeah. But yeah, so as soon as I put the points in, she noticed the right side of her head. She noticed starting to soften right
Hmm.
away. She noticed there was like the
Hmm.
softening around her ear, around her neck, and down. And then over the course of the time while she had the points in, by the time I took them out, she noticed there was like a whole softening inside of her head. So the headache wasn't gone, but it was drastically reduced. And
Hmm.
she said the day before, she just had the local anesthesia injected into her head, and she did have relief for a while
Hmm.
from it. And she said, but it was a numbness. But
Hmm.
after acupuncture, she said it was like an actual letting go and a softness. And what she noticed is that inside of her brain, it felt like soft. It felt relaxed inside of her brain and not numb. And she said it was such a nice feeling. And
Yeah.
overall, she felt very, very relaxed,
Hmm.
which was very welcome because to be in that level of discomfort is really stressful in the body. So, yeah,
Yeah, and I think that's really important to know. Like when while we're using balance method, that like that's how we know that we've hit something right, right? Is that like while maybe we're looking for a 50% reduction in pain scale, I feel like 20% reduction is a huge win too. But yeah, we have such like great tools, and I love that you use the Jingwell points. You just chose to use the hands to treat the face and
yes,
head, and I use the foot to treat the head and face. So
yeah,
it's like it's great that we can choose all these, we have all these points access
mhm,
to us, right? And it's just a matter of our own intention and how we what feels right for us in the moment as a practitioner. I love that.
yeah, definitely.
Hmm. Hmm.
It's amazing, and to be able to like get the feedback that acupuncture was a tool that helped
Hmm.
shift her
Hmm.
better than local anesthesia to me just blows my
Hmm.
mind.
Yeah, it blows my
It
mind.
blows my mind. Like she's
Yeah.
on all the medications, and acupuncture in 30 minutes was able to
Yeah.
give her the shift to get her on this path of getting rid of these chronic headaches. So,
Right. Because it's not just pain we're treating, we're also like realigning the nervous system, right? To like come back into center, to trust her body, and then to move forward, right? Like that's one
yeah.
of the biggest things I feel like acupuncture is the best at,
Oh,
right?
it's so good. Yeah.
That tricky
Yeah.
little nervous system we have.
Yeah.
Yeah.
Well, thanks so much, Sarah, for joining me. There we have
Thank you.
it. We had two acupuncturists in one case and two different treatment plans.
Love it.
How we would treat a chronic headache. Go ahead and try these treatments out yourself and let us know how they go.